Welcome to the module on vital signs. This session focuses on the human body pulse. Before we begin, let's quickly take a look at the key learning objectives. After completing this module, you will be able to explain what is pulse, explain all the factors that affect pulse, and accurately measure pulse. Let's now understand what we mean by pulse and why it is important to measure the pulse. Click the images to know more. Pulse is the rhythmic dilation of an artery as the heart beats and rests. Checking your pulse allows you to determine your heart rate, heartbeats per minute, without any special equipment. Pulse is easier to locate in arteries that are close to the skin, which can be pressed against the bone. A strong pulse indicates good pressure and functioning of the heart. A weak pulse indicates an underlying health problem. Here are the most common sites in the human body where you can measure pulse. Click each site to know more. 1. Radial site is at the base of the thumb, and it is the most commonly used method to measure pulse. 2. Temporal site is on a side of the forehead. 3. Carotid site or side of the neck. 4. Brachial site lies on the inner side of the elbow. 5. The femoral site is the inner side of the upper thigh. 6. Popliteal site lies behind the knee. 7. Dorsalis pedis or top of the foot. 8. Apical pulse or over the heart. This pulse is taken with the stethoscope on the left side of the chest. Now let us know some facts on the range and volume of normal pulse. Normal pulse is in the range of 60 to 100 beats per minute. It is always noted as a number of beats per minute. In case of normal pulse, the heart rhythm is regular, and the volume of the pulse is strong. Various factors that affect normal pulse are age, sex, position, drugs, illness, emotions, activity level, temperature, physical training. Now let's understand the steps to measure pulse. 1. First, wash your hands. 2. Place your forefingers on the patient's wrist. 3. Don't use your thumb when finding the pulse, as your thumb has its own pulse. 4. Make a note of the rate of the pulse, which is the number of beats per minute. 5. Check the strength of the pulse to see if it is strong or weak, and if the rhythm is regular or irregular. 6. Record the rate, strength, and rhythm of the pulse. Now let's see what you should do in case you are unable to find the pulse. Use your fingertips instead of placing your fingers on the wrist. Vary the pressure of the fingertips on the wrist. You may need to lighten up or press harder to feel the pulse. Hold the arm pointing down towards the floor while finding the pulse. Now let us see a demonstration on how to check the pulse.
Welcome to a video on measuring pulse. This video is brought to you by Vadhvani Foundation. Material needed: alcohol solution or soap. Watch with a second's hand. Patient record. Measuring pulse. Wash your hands with alcohol solution. Confirm the patient ID or number. Place your forefingers, not the thumb, on the patient's wrist. Make a note of the rate of the pulse, which is the number of beats per minute. Check the strength of the pulse to see if it is strong or weak, and if the rhythm is regular or irregular. Record the rate, strength, and rhythm of the pulse.